Global Handwashing Day 2023. If you want to protect your family, your friends from catarrh as well as diarrhea, then you know that you are also preventing them from spreading germs all over to other people. You must be celebrating Global Handwashing Day today, this 15th day of October 2023. So my lovely listeners and fellow healthcare workers, I, Dr. Hadiza Murlia Suleiman, your favorite holistic reconstructive surgeon, will be sharing with you 3 key hand hygiene and hand washing tips this Global Handwashing Day. All right? First, I'll be telling you 5 steps of hand washing with soap and water. Secondly, I'll be telling you the important times for hand washing. And lastly, where are all my surgeons, my doctors, my fellow health workers? Where are they at? You cannot afford to not know the 5 moments for hand hygiene. Find out today just how many of us are really doing this, all right? I have the data, guys. The 5 steps of hand washing with soap, yes, and water. Can you see the water? If soap and water are not readily available, you can use a hand sanitizer like this. Yeah, you can use a hand sanitizer if you don't readily have soap and water available to you. When I say soap, I also mean, hand wash like this, all right? It doesn't have to be your bar of soap. Hand sanitizer that has at least 60% of alcohol in it to clean your hands. First of all, you wet your hands with clean running water, mind you, clean running tap water, not water that has been stored in a reservoir, all right? Turn off the tap and then apply your soap. Apply your soap. Apply either your soap or you can apply your hand wash, all right? So lather your hands, lather the backs of your hands, lather the backs of your hands, your wrists, in between, under your nails, at least 20 seconds. Do you need a timer? Yes, you need a timer, an internal timer in your head, all right? So hum this. Happy birthday to you. Happy birthday to you. Happy birthday, dear me. Happy birthday to you. That's roughly about 20 seconds. You now rinse your hands under the running tap water, clean running tap water, and then dry your hands. Dry your hands. Dry your hands using a towel, a clean towel. Or if you have an air dryer, wherever you are, you can use an air dryer. You see air dryers usually in public places, in airports, in hotels, but some people have air dryers even in their homes. Let's teach all our children how to hand wash properly. Now, what are the times for hand washing? The key times to wash your hands, according to the Centers for Disease Control and Prevention. 1, before, during, and after preparing your meal, after preparing your food. Before and after eating your food. After using the toilet for whatever reason. After blowing your nose. After blowing your nose. Coughing. After sneezing. Before and after caring for someone at home who is sick with vomiting and diarrhea. Before and after treating a cut or a wound anywhere on your body. After changing those napkins, after changing the diapers for your baby, or after cleaning up a child who has used the toilet. After touching an animal. Yes, all our pets. After you touch the animal field, the animals, or even animal waste, after you cleaned up animal waste. And then after handling pet food or pet treats, all right? As I mentioned before, the animal feed. And then after touching garbage, after touching your dustbin, after touching those nasty things in the dustbin. And then the moment, ta-da, that you have all been waiting for. Let's see just how many of us are actually practicing the 5 moments for hand hygiene. My fellow surgeons, doctors, and healthcare workers. Do you know the 5 moments for hand hygiene? I'm sure you know them, so let's just reiterate them, all right? The 5 moments for hand hygiene are: moment 1, before touching a patient. Do you know that only 39% of health workers have been found to be compliant with this? Moment two, before a clean aseptic procedure. For example, procedures like taking your blood, drawing out blood from a patient, giving someone an intravenous injection, giving someone an intravenous medication, for example, when you're preparing for surgery, when you're prepping a patient for surgery, when you're prepping for surgery. Did you know that only 63% of health workers have been found to be compliant with this at all these times that I've mentioned? That's not too good, is it? Moment three, yes, a bodily fluid exposure risk like blood, saliva, urine, of course, feces. It has been found out that only 65% of health workers have been found to be compliant with this. How about moment four? We're almost getting to the end. After touching a patient, did you know that only 76% of us health workers are compliant with washing our hands, sanitizing our hands after touching a patient? And then finally, moment five that you've all been waiting for, after touching a patient's surroundings. And hey, this is like one of the worst. Okay? Because only 36.5% of us are complying with this. When we're about to enter into a patient's room, we touch the doors, we touch the door handle, we push the door open. When we're in the room, we touch the bed sheets, we touch the linen around, we touch the curtains. Not too good, okay? So you're helping to spread germs. And so, since only 36.5% are compliant with this, moment five, we need to work on ourselves. The World Health Organization has said that compliance with these hand hygiene recommendations in our routine healthcare delivery is really, really low all over the world, with an average of just 59.6% compliance levels in all intensive care units up to the year 2018. And there are extreme differences between high-income and low-income countries, as well will be expected. High-income countries having a compliance rate, effective hand hygiene of about 64.5%. Low-income countries can have a low compliance rate of as low as 9.1%. Boom, 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 boom. What helps me on the wards, when in my ward pocket, what helps me on the wards is I usually carry around this hand sanitizer. It's like a pocket-friendly, lab coat-friendly, ward coat-friendly hand sanitizer. I always put it in because sometimes when you do ward rounds, wherever you are, in the world, you may not have access to running tap water. And that is the ideal for washing your hands. It shouldn't be stored water. It shouldn't be water in a reservoir. And so I always carry this around. This helps me keep my hands clean. But of course, washing hands with your hand wash, with your soap and your water, running tap water, is the best way to get rid of germs in most situations. These hand sanitizers should contain at least 60% of alcohol in them. We know that sanitizers can quickly reduce the number of germs on our hands in many situations. However, sanitizers do not get rid of all types of germs, and hand sanitizers may not be as effective when hands are visibly dirty or even greasy. Hand sanitizers might not remove harmful chemicals like pesticides from our hands. And be very careful, okay? Swallowing alcohol-based hand sanitizers can cause alcohol poisoning if more than a couple of mouthfuls are consumed. And so please keep them out of the reach of young children and supervise their use. So lead by example by washing your hands. Watch my Harmattan playlist because the Harmattan season is coming and you need to prepare and take care of yourself. See you.